This is my mom. She's a really good doctor.
Hi, I'm Dr. Lex, but I'm also mom to Isabella, Lance, and Lucia.
Our mom takes care of our family, our friends, and her patients.
On this podcast, our mom is going to be talking to her doctor friends and teaching you how to keep your family safe and healthy.
Okay, Mom.
Ready for the show?
Let's do it!
Welcome to Family Health with Dr. Lex. On today's episode, we're interviewing my friend Dr. Rajeev Fernando, a board-certified internist and infectious disease specialist who has been studying COVID for the past year. Let's welcome him to the show. I have my shades on because it is too bright for this superstar. Dr. Rajeev Fernando is here, my old friend, and by old, I don't mean old in age. I mean, we go way back to our days of Southampton Hospital, working in the Hamptons. This is my friend Rajeev Fernando, everyone. He is a board certified infectious disease specialist. He's an entrepreneur. He's an activist. He is a social activist for change. He is an educator. He is soon to be Harvard educated. And I would love to bring my friend to you with some information, updates, projections, forecast about COVID. Dr. Fernando, welcome. Please tell us why my friends should trust you as an infectious disease expert on COVID.
Alexis, the compliment is mutual. I wish I could find my sunglasses to say how cool and awesome you are. Thank you so much for having me on the show. It's always a pleasure to talk to you. And thanks to your audience, all of you, for joining in. I'm always happy to, come out, talk, and, try to keep America safe and actually the world. So why you would listen to me? For starters, Alexis gave me a generous introduction. And my journey with COVID-19 actually started in January 2020. I remember when I was we have infectious disease doctors, we have an email chain where we get emails every day in the morning, which say what kind of diseases are going on, what part of the planet. Like, let's say you have a meningitis outbreak in Italy, or let's say you have a rabies problem in Africa, which say Tanzania. And one thing in mid-December, it caught my eye, and I heard about this new virus that was going on in this area in China. And it just seemed so similar to what I'd heard in 2003, the SARS-1 outbreak. And it was just so hard to ignore. And unfortunately, I was spending time with my family for Christmas in India. And when I told my parents, I really want to go to China and investigate this, they said, no, you're not going anywhere. We see you like once a year, spend time with the family for Christmas, and then you can go. So as soon as I got back to the States, I quickly started planning a trip. And I knew I had to go there because for the sake of mankind, really, because at that time, China was saying this virus, there's no evidence of human-to-human transmission. And I said, that's not possible. This virus is going to transmit human-to-human. And also, when I was planning to go there, the WHO also echoed China's thoughts, and they said there is no evidence of human-to-human transmission. So I quickly booked a one-day trip to Wuhan, China, just to go in and out, because, I'll tell you something. China is the second highest country in the world that arrests investigative journalists, which means you disappeared. You say something about, the Communist Party, you're gone in a second. This is second only to Turkey. So I knew I had to get in, get out, do my investigation, get in, get out, and leave. So everything was planned. I was literally there on the ground for 24 hours in Wuhan, China, investigating this. Things went horribly wrong. As soon as I got there, there was, the contacts I had made, they didn't answer my phone. I was supposed to do the story with CNN Hong Kong, actually. They didn't pick up the phone. Something was drastically wrong. And I immediately sensed that there is information that people are hiding over here. So the way I did this, of course, was we visited the market to see what's going on over there. Didn't get much information. But at this point, China had called and said, China was saying there are only 50 cases in China, which didn't make any sense. The public in China or Asian countries, for example, they know what's up, in the sense they've seen respiratory virus outbreaks or epidemics. They know what's going on. When I was walking in the streets over there, everyone was in a mask, and that itself just tells you, despite whatever the government says, the people over there sensed there was something wrong. And then I was able to do contact tracing, and I did see, people who weren't in the market, people who are exposed, who didn't have exposure in the market, traveling back to Japan and Thailand, and they'd brought it over there. And these people had no exposure to this wet market. And that's the point I determined that there is going to be human-to-human transmission. And I was very concerned. And I brought that information back to the States and started disseminating this information. But I could have never predicted this degree of a pandemic. Obviously, what really concerned me was the way China was just letting people out, they were leaving. Me, of course, they stopped me at immigration and they took my passport for about 40 minutes. And I had no idea what was happening. They said, "Why are you in China for 24 hours? I said, I'm just here to catch up with my friend for coffee. They said, who comes from America to get coffee for a day?
That wouldn't surprise me if you did that, but.
Actually, I miss doing happy hour in London. I got to tell you that honestly, good times. But that was way back last year, and it's unbelievable to see how this pandemic has spiraled into what we've had, probably the greatest catastrophe of the century.
So one of the things that I talk a lot about with my audience here is how difficult it is to find reliable information on the internet. There's a lot of information out there, and it's very hard to know who to trust. So your experience over the past, for your career, but especially over the past year in terms of educating the public, is one of the main reasons that I wanted to have you here today. And I'm so happy that I know someone who is so knowledgeable and so vocal, outspoken, and can relay the science and the information with ease and understandability. So what the hell happened? How do we get to this point where what was supposed to be a 2-week lockdown turned into a whole year? And am I too optimistic to be thinking, hopefully, that we are on the other side of this?
Well, there are a lot of things to say. First of all, I just think, we can clearly see Asia did very well in this because they've seen this before. They've seen what respiratory viruses do. Countries like Taiwan and Vietnam, they knew exactly what was going on. They did contact tracing very early, which means if you land in Vietnam or Thailand or Taiwan, really small Asian countries, they're tracking you from the get-go, which is when you arrive there, they do a PCR test in the airport, they're giving you a contact number, you have to text the government, or the government will text you to see whether you have any signs or symptoms. They were on top of it from the first minute. And that's why cases in Asia still remain very low. But the United States, Europe, the Americas, we've never seen anything like it. So governments were very, very slow to react to this. Like I said, respiratory viruses all the time, they happen over there. And these wet markets, which, for example, SARS-1, when it happened, the same situation from a wet market. And at the end of SARS-1 in 2003, I recall, the Chinese government made an order to close these wet markets for good. It just lasted about 6 months. It was reopened, and I'm not trying to point fingers at China right now. I'm very unhappy with a lot of things they do, but not making this political. But they reopen these wet markets, so they know, they're sensitized there. But us in the United States, the Americas, and Europe, we did not know what's going on.
Do we have a false sense of hope that we are headed in the right direction? What is the status going forward? Are we seeing progress? Are the numbers decreasing to a satisfactory degree? And how much of that is due to what we're seeing in terms of the vaccines, the weather? What's your forecast?
Great questions. And I think personally, where countries which are vaccinating aggressively are doing well. A role model country for me is Israel. And I was just in Dubai yesterday. And thanks for rescheduling my 3:30 a.m. interview with you. I didn't calculate that well enough. Thank you again, Alexis. So these countries have done remarkably well, where they've actually vaccinated 50% of their population. Places like Israel, I mean, you pretty much have an app which is on your phone, and you can gain entry into a bar, a club, as long as you show this app which says I've been fully vaccinated, and you get on with your life as normal. actually. So these are countries which are doing well. I will say that I'm very, very happy with this new administration. I mean, it was supposed to be 100 million vaccines in 100 days, but they cleared that in 58 days. And the United States has the biggest vaccination campaign on earth right now. It's phenomenal, 2.5 million doses a day. And that's really the secret for me. Like, vaccination is key right now, and that's the countries that are not able to do that are suffering. Europe hasn't had a good vaccination plan and they're suffering. Brazil hasn't had the same good vaccination plan. They're suffering. India doesn't. So my concern over here, Alexis, is, like I said, I think the States is doing well. We're not out of the woods. Coast to coast, I feel, and nothing personal, but people tend to follow mask wearing very well. I was in Texas for a while. It was kind of difficult for me to advise mask wearing, but it's getting better and better. But I think at this point right here today, 27 states in America are still showing rising trends of COVID-19. So it's not over yet. And I know a lot of states are lifting these regulations, but I also urge people to use common sense. Very important. It's important just not to say, all right, we can do this, that's what the law says, but no, you urge you to use common sense also. So, and I'm all about, if you, let's say you're 2 people or 3 people in a group, or 2 people who have been vaccinated, fully vaccinated, I like the CDC rule, which says, you know what, both of you have been vaccinated, it's been 2 weeks, go for it. You don't need your mask anymore. And I like things of that. And that's what I like to, my media campaigns are all about that these days, which is, when I sell this kind of concept, my concept is towards normalcy. When you get a vaccine, you can get your life back again. You can make out with as many people as you want if you, as long as they're vaccinated. Yeah. It's not easy having sex with an airborne mask. Let me tell you that. It's quite unpleasant. I can tell you that.
So once we're allowed back out in public, it's going to be, I think if you put it that way, I think there might be a huge push.
I'm telling you.
For the 24 to 29-year-old population, where the numbers are still pretty high. I think our highest rate or highest incidence now is in that age group of 24 to 29. So maybe we'll just start announcing that, you can get back to your regular.
I'm telling you, Alexis, this is that's the kind of thing the CDC maybe can do, but I'm all about it. I'm like, yo, listen, get back to your normal life. Just get vaccinated, use common sense, get vaccinated, and just try to get back to normalcy. Yeah. The other thing I'm concerned right now, Alexis, is, because Europe is doing a bad job and because Brazil is doing a bad job, they're going to keep, with vaccinating, they're going to keep building more and more variants. And one of these people, remember, it just takes, everything is one flight away. That's how it is with these pandemics. And, one of these people who flies to New York or to LA, one of these highly populated areas, and it just spreads. So the US, it's great. I'm very happy the way things are going. But, as we think on a global scale, and remember, when other people don't get vaccinated, they bring their strains here, and it's concerning.
So we're a country of 350 million people, and we hear the word herd immunity all the time. Yes. Can you explain to me what the frig is herd immunity and how do we get there?
Sure, of course. Herd immunity is a term that when enough number of people get vaccinated and enough number of people in America have had a natural infection, you combine both of these together, and that's what constitutes herd immunity. So concept of, a few months ago that people are floating this concept of saying, well, we don't need vaccines. We'll just get herd immunity. We'll just wait and think. But that's not plausible, because if you're going to get herd immunity that way, we're going to lose more than 1 million lives, and that's not going to work. But what's really helping us right now is our vaccination campaign. So it takes 2 hands to clap. Vaccines together with natural infections, and that's how we're going to achieve this. We know 1 in 4 Americans have been vaccinated, at least a single dose. I'm really happy with the progress that we're doing. It's an inspiration to the planet. That's what I think. And we just have to keep doing our thing. And on the flip side, I see events in Miami yesterday where people just don't use common sense. And that's terrible. Unfortunately, it's when people like that do that, the rest of the people get affected as well. So irresponsible behavior, just sad. We just have to keep going the way we are. Like New York is doing very well. I'm pretty happy
Yeah.
with their progress.
They got over that hump kind of early on. I think have been pretty successful in containing and working towards. But I think the shock of having gone through that initially was probably enough to scare most people into kind of cooperating and following the rules. What percentage, what numbers do we need to reach in order to see herd immunity?
A great question. The numbers are still variable. I mean, I know Dr. Fauci, who of course we all respect, he mentions 70 to 85%. For me, I think that number is not clear right now. And I'm glad he put it a big number, like 70 to 85%. That I think it's too early to call. But different diseases have different situations. Say, for example, measles, you need to have 95% before you actually say there's herd immunity in the community. And why is that? Because measles is one of the most infectious pathogen there is known to mankind, which means if you have a person with active measles and you're in a room with 20 people who've not been vaccinated or who've not had measles before, those 20 people are going to be infected within an hour. That's how deadly and dangerous it is. And that's why you need such a high amount. Now, that's something we call the R naught. And the R naught tells you the number of people, if you're infected, how many people will you infect? Now, for measles is 1 to 18. For COVID-19, we're thinking around 1 to 2. That's what we think right now. One person can infect 2 people. But once again, America is lacking so behind in contact tracing, and that's the real problem. That's one of the problems that we have. 2 things I think the United States has to improve on is contact tracing. And the other thing is what we're not doing enough genotype testing, which is in order to know how much of a variant is, we need to do genotypes. Like HIV, it's not enough to say, oh, you're HIV positive, but I need to know what strain you have so I can treat you appropriately. So right now we're not doing enough of that. And I am very concerned about that. We need to, do more tests, more genotypes. But I want to caution and let all our viewers watching is that the deal with variants right now is the ones that are coming out of South Africa and Brazil. I don't want people to get alarmed. These new variants have the potential to cause severe disease. We don't know that yet. Okay. The one from Brazil and South Africa, they have possibly or potential to cause severe disease. And everything is so dynamic. Let's say, for example, the UK strain a few months ago when they were talking about it, they said there's no change in mortality. Initially, they said it's more infectious, but just a couple of papers 2 days ago, I read from the Lancet, and now they're saying it's 65% more higher chance of mortality. Right. So it's very dynamic. And like, if I go back to interviews I did, for example, in April, I really want to hide my face and put a bucket all over it because it's so dynamic, Alexis.
And I think people get frustrated by that. Everyone forgets that all of the specialists, scientists, doctors, and experts are going through this in real time as well. And we are learning as in practice as a hospitalist, as you know, the guidelines, the rules, they change every day. In the beginning, there weren't any rules. It was kind of, let's treat this as broadly as we can. And as we learn more about it, we learned what works and what doesn't work in terms of treatment. We're learning what the variants will look like, what the vaccine science looks like. And so I think that's what's frustrating to a lot of people is that because we don't know, and because the experts don't know, and we put out information and guidelines, and those guidelines are constantly changing, it feels to some people like maybe we're being given misinformation. And so I feel like there's a lot of distrust in the medicine and the science, and that creates a problem because then there is a whole subset of people who are not wanting to get vaccinated, who are politicizing it, and who are feeling like this is there are some ulterior motives to the vaccine campaigns. And so it's really difficult.
I'm so sorry, Alexis.
Yeah, no,
just very quickly for our viewers, just to debunk this vaccine, I think. So there's one thing I can tell you with 100% certainty, and I want you to remember, if you get the vaccine, you are 100%, you're not going to get admitted to the hospital sick, or you're not going to die. I mean, it's very straightforward here. I mean, you're going to see these variable amounts, even They say different strains. Will Pfizer work? Will Moderna work? And the answer is yes. Remember the spike protein itself, the vaccine, the antibodies are made to the entire spike protein. There's certain mutations on smaller parts of the spike protein, but take it to the bank. And I want our viewers also to understand that irrespective of what vaccine, you have 3 in the market right now, different vaccines give you different coverage. So let's say, for example, the Johnson & Johnson vaccine will protect you in about 80% of times, with 80% of times with symptoms, but 100% chance with death. Moderna, Pfizer, forget about it. 95%. You won't have any symptoms, and 100% you won't die or go to the hospital. Right. So these are absolute numbers which are fantastic. The other one we just had, AstraZeneca, it's the same number as 100% sure you won't die. So I also think, I feel this is a good time for the United States to get back onto the global scene and lead, because we are going to have a surplus of vaccines in a couple of months. That's right. My take.
How do you address the idea that the research and the vaccine science was rushed and maybe not the higher quality or the standard quality that we have seen in prior vaccine science? How do you address those kinds of concerns for people?
That's a great question. And I think it goes back to our earlier discussion where we do have some experience with SARS-CoV-1, which is in 2003. Now that was into production. They started working on it. But what happened? That was a very different virus. It had a mortality rate of about 10%, crazy mortality. But once again, it just disappeared. It was gone by the end of the year. After all the damage it caused, it just disappeared. That's exactly what happened. And that's why they didn't pursue it, because it's gone. I mean, but they had some preliminary work done on coronavirus. Remember, it's SARS-CoV-1. And that's what happens. And I think that's really what gave us a head start. To be perfectly honest with you, we've had some research done on SARS-CoV-1, and that's what happens. Now, let's say, for example, poorer countries, let's say, for example, Zika virus, which really hit the South American continent very badly, South American countries. There's just nothing into it because these are poor countries. No one gives a damn. They came, and what's going to happen next? It'll come and it'll hit back. But there's no vaccines. It's 6 years. So this is what too many people don't know, is really there was some preliminary work that was done on SARS-CoV-1. And that was sort of, if you'd like to say, kept in a bank or whatever you like to call it. So this time around, they were very quick to get underway with this. Like, companies were very quick to pounce on it. Check the same. I mean, about 85% of the virus, SARS-CoV-1 and 2, are homologous. I mean, they're virtually more than 80% are the absolute identical. So that's why I feel scientists, you're absolutely right. The fastest virus vaccine to develop prior to this was the mumps vaccine, which took 4 years to make. And that's why I'm glad we're doing this this podcast, because I don't blame the viewer to say what is going on. First of all, there's no vaccine, there's no virus in these Moderna, Pfizer vaccines, so there's no chance you can get COVID. It's impossible. Like anyone who gets a vaccine and says, I'm COVID positive the next day, they're probably harboring it before, as you know. But that's probably what happened. And can you imagine if we've had, I think the globe has given about 450 billion doses of vaccines over. Can you imagine where we would be without these vaccines? I mean, it would just be going on without any hope, but vaccines give us hope, I think.
So because of that prior experience that we had and the science that we started back in 2003 with the first SARS virus, we can have confidence that this vaccine was not rushed to production, that the science is accurate, and that the vaccine is indeed safe and effective.
Oh, absolutely. I'm definitely, with certainty, I will tell you that scientists had a head start on this, and they were working on it for months. It wasn't, like I said, and that's the reason it's out so quickly. But I'm so happy it's come out. We're seeing real life changes. The elderly people are, in particular, nursing homes are opening up. Kids are able to hug their grandparents again. Just phenomenal. It's really changing the world. So I urge people, like I said, take to the bank. You can if anyone watching this gets COVID and goes to the hospital or gets intubated, please call me and let me know. I'm happy to take care of your hospital bill, because I'm saying that with that kind of certainty, that how important it is for us to get vaccinated and really try to end this actually.
I'm a hospitalist. I work in taking care of inpatients in the hospital. And even as recently as December, prior to the massive push to vaccinate in our country, we were working at a census across 27 hospitals of about 100 to 110 patients, which is a lot for us. Our baseline is somewhere between 45 to 60. And we're back down now to that normal range. So I love to think, and the majority of what we were seeing in the past year, as most places, was COVID, because patients who were having other illnesses were afraid to come to the hospital. They didn't want to get COVID. So we saw a lot less of all the other stuff. And for the past year, we've basically been taking care of mostly COVID patients. So just to give you an idea, we've basically in the last 3 months with the vaccine push, gone back to our pre-COVID baseline numbers in the hospital. We're seeing a lot less of it in the hospital. We are intubating a lot less patients, and we are sending more patients home. Yeah. So with the vaccine, how long, because a lot of people I've heard say, well, I had COVID, so I have natural immunity. How long does natural immunity last versus vaccine-induced immunity? And will this vaccine be something like the flu vaccine where we'll need to get it every year?
Those are all great questions. And I'll start with by saying the difference between natural immunity and vaccine immunity is variable. So we've seen this so commonly where people say, you know what, I didn't get tested. We didn't get tested for COVID, but I swear I had that syndrome. You know, fevers, cough, loss of smell, loss of appetite. I'm so sure I had it. But and that time, you know, the PCR test was not available. So people are getting antibody tests, but it came back negative. And then some people who've had COVID-19, they have had antibodies for 6 months, 8 months, 9 months. And some people who've had it just you do the antibody test and you don't find antibodies. And my response to this is antibody levels are variable, which means then when someone gets infected, it's variable based on your genetic predisposition, on other environmental factors to say how long you're going to have immunity. That's unpredictable. And that's why I use the phrase variable to say, well, you're probably going to be protected for a couple of months, which is good, but I can ensure that you've had COVID-19 and these antibody levels will last for a protracted period of time. So that's one. With vaccines, I'm predicting about 9 months at least protection. So I would think that is the way to go. It's unclear, but it's certainly a possibility that we will need a yearly vaccine for COVID-19. Now, let's compare that to the flu. For example, the flu is a very weak, a very fragile type of virus, a very fragile virus, which means it mutates very, very frequently, which means when there are that many mutations, every year you have to change the vaccine because it's a weak, fragile vaccine virus. It's changing all the time, and that's the way it rolls. Now, COVID-19 is actually more sturdy virus. It doesn't mutate, or it's not as weak as the flu virus. So certainly there's a possibility that, you know, we may be needing vaccines, yearly vaccines, but hopefully not. Like it remains to be seen. The answer to both these questions is really to develop what we call a universal vaccine, and that's the holy grail of vaccination. If we can get a vaccine which is universal, which protects you from different strains, that's the holy grail in this situation. I'm thinking ahead, but that would really be it. If you get a universal vaccine, it'll cover all the different strains. But right now, just go out there and get vaccinated, because the faster you get vaccinated, the lesser the chance of, remember, it still will protect you against the variants. So just go for it, get your vaccine now.
So we get vaccinated, we achieve herd immunity. Is there a possibility that we will return to normal? Will we be able to resume our lives maskless? Will our regular social interactions, concerts, air travel, will we be able to do that again? And if so, how do you forecast or predict that in terms of a timeline?
Sure. My prediction is we will, it's unfortunate, but this is really what's going to happen. We need to carry a vaccination card, or when we travel, it's called a passport of immunity. So, which means if you're going to travel internationally, you're going to be asked to say, hey, can you give me proof that you've been vaccinated twice or with J&J once, and you've had 2 weeks since your last dose? If you're able to produce that, I mean, we have to get on with economy and things like that. So
Yes.
if you're able to international trade, business, if you're able to produce this on entering countries, I think that is the future, not just within the United States, but across the planet. We are going to have to carry these vaccination apps, maybe, or vaccination card to say, I've been immunized with this vaccine.
Mhm.
And I'm sorry to the anti-vaxxers out there, there are going to be problems for you guys. I'm not trying to twist it towards anti-vaxxers, but there are going to be situations where probably an employer says, you know what, let me just, two people, same qualifications. You're going to say, well, let me just pick the guy who's vaccinated. I don't want to deal with these nonsensical problems later on. Let's say I pick someone, he's not vaccinated, he spreads it. We're coming out of a disastrous year, and people don't want to deal with any more unnecessary nonsense. So my sympathies to the anti-vaxxers, because you're going to be left behind. I hope, but I'm forecasting this is what's going to happen. Now, places can't mandate things. Now, let's say in hospitals, you're mandated to get a flu vaccine because that's FDA approved. Now, with vaccines, they're all EUA, emergency authorization. So until the FDA actually approves it, I mean, there's no one who can push you to do it. But trust me, I think that's the future for the next year. Americans have seen how bad this is. And really, people want to minimize this. I mean, we've already businesses are all going out, and just it's such a hard year.
Yeah.
But employees, when they come back, New York City is like a ghost town right now. It's unbelievable. It's lost its pulse. Big people, companies, they say, well, why do I have to spend $20,000 with an address in New York City when there's Zoom around? So things have changed forever. And so that's why I think, it's really important to consider getting vaccinated. It's totally safe, and it's probably the way to go.
It's hard to believe that. I mean, we have worked on the front lines, you and I, and we have seen it, and we've had the conversation with the gentleman who's about to be intubated, and have watched him FaceTime his wife, maybe for the last time. And we've seen that, we've been through it, we've cried with those patients. So it's very hard to accept and process the fact that people still don't believe or accept how important this is in terms of getting back to normal. Everyone wants to get back to normal. So I just hope that everyone can appreciate what you're saying, understand the science, believe the science behind it. Our life expectancy would be back what it was 100 years ago if we didn't have vaccine science. So
it's true.
And it's I think just at this point, when people are threatened with not being able to return to normal, or not being able to do the things that they want to do because they are not vaccinated, my hope is that they might reconsider and they might go ahead and go for it. Now, so many people are so concerned, and rightfully so, about our children's mental health and well-being. We are seeing an increase in teenage and adolescent depression and suicide. We are seeing a drastic increase in drug and alcohol abuse, addiction, and overdose. And we are just starting now to believe it's okay and to proceed with getting our children back into school. I've learned in reading and other discussions that our children may have improved immunity because a lot of pediatric viruses are in the coronavirus family. So number one, is that true that our children may have some innate immunity to coronavirus because of other viruses that they've been exposed to? And do you believe that it is safe for us to be putting our kids back in school with social distancing and universal precautions?
Yeah, very, very challenging questions. And yes, let me take them down one by one. So absolutely, the common cold is really a coronavirus. And, that's my wishful thinking 20, 30, 40 years later, that this strain of COVID-19 becomes the common cold. And someone will say, oh my God, this is the common cold right now. But in 2020, it killed half the planet. I mean, it just caused so many cases. But that's my hope eventually, that COVID-19 will become like the common cold. It'll become so prevalent in society that it'll become like that. But I really, for the reasons, as you know, Alexis, we're in the healthcare world, and everything is what we call a risk versus benefit situation. We know that. And so for the reasons you mentioned, those are some really critical problems. And one of the things I'm trying to do with my charity is we're also trying to work with, I've been talking about it for about a year now, and we're trying to get going with it, is mental illness, not with just kids, with adults as well, you know? So it's going to be a really, so we're forgetting all the other stuff, the consequences, which is, you know, there's COVID brain right now. There's new data that it can cause dementia, almost like Alzheimer's, Parkinson's, that kind of dementia. I mean, your lungs are worse than a smoker's lungs. I mean, these are real situations which no one's even beginning to talk about, but it's all there. And for let's talk about why the 6 feet rule really came about in the first place. So these are called, COVID-19 is a respiratory virus. Respiratory viruses are big molecules, actually. So they're respiratory droplets. And the way I like to teach my students are droplets drop to the ground, which means if you cough, they drop to the ground within 5 feet, done. So you can honestly, perfectly speaking, I don't advocate for anyone to do this, but in theory, if someone's 6 feet away and coughing without a mask and you're without a mask at 6 feet distance, you're not going to get it, because that's the way the physiology of this virus works. When you cough, you thrust it forward and it'll go a certain distance and droplets drop to the ground, as opposed to pathogens like tuberculosis where they spread. COVID-19, the virus, it will drop to the ground. So now the whole issue with getting kids back to school is the 6 feet distance is really, really difficult to implement in schools right now. And this is a pretty good study. I like it. It was published in the New England Journal of Medicine last week, which talks about that lowering it to 3 feet doesn't really do any less harm. So it might be a good approach right now. We're really trying to, you know, get things back to normalcy. So 3 feet is good enough as long as you're wearing a mask. I'm going to stress on that part. As long as you're wearing a mask, go to school, the usual distancing. If you're going to be within 3 feet distance at the cafeteria having lunch, take it down briefly. You know, make sure you eat your food quickly and put that mask back on. But I think it's perfectly safe. And for the reasons you mentioned, my goodness, our poor children right now. I mean, the things that they're going through, like, you know, it's just not normal. And, you know, these will have consequences down the road. Like, that's why for me, I always advise to just call this a washout year, really, when people were starting, going to school, stopping, which I feel just worsened things. I said, you know what? Like countries like Syria, for example, these poor kids, you know, they've lost a generation of kids because this war has gone on for 10 years. I said, you know, in the grand scheme of things, just let it go. Let these kids go for a year. You know, it's more traumatic for them, I feel, to start, stop, and they're all confused. And I just said, you know what, call this a washout year. And they know we can't do that. I was like, hey, this is the worst pandemic of the century. We'll probably never see this again. Forget it. It's a washout year. Let these kids chill. Just don't do that, you know. And I'm sure like so many kids are traumatized by this whole experience, you know. So I think it's a good time to restart. You know, we've got precautions. And remember, I always urge people, it's got to be a cooperation between three: parents, administration, and the state. So if the state says, let's start, and our family says, let's start, but the school says, yo, I'm not ready, you're not ready. Because that's, you know, we've seen these situations before, and I've given advice. Immediately when parents asked me, I said, if the school says they're not ready, they're not ready. And that's it. I don't care what the state says. I don't care about anything else. The school, all three have to have lengthy discussions to make sure our kids are safe. With regards to COVID vaccines in kids, we have some great studies that are going on. My prediction is we'll probably have vaccines for kids by fall. That's what I feel. They're great studies. Like I said, they can be shorter because we've established safety in adults, which is great. So where the trials are going to be shorter, my prediction is by fall, we should be able to get our kids vaccinated.
That was my next question. Thank you for answering that ahead of time. I think that they see us scrambling for answers, and they always look to adults to know. And when we don't know and we're uncertain, it makes them even more uncertain about the future of things. So I think one of the best things we can do for them is, you know, educate them and, you know, practice hope and safety and common sense. Like you said, we teach the kids. My nephew is 3 years old. My daughter is 6. And, they walk around telling other people at the playground, you need to put your mask over your nose. We're teaching them not necessarily to be frightened or scared, but to be cautious and have common sense. And hopefully at some point that will revert and they'll be able to play normally. But until then, until we know that, our goal is to keep as many people as safe as possible. Rajeev, you mentioned your charity, and I do not want to end this wonderful conversation without you being able to tell us about the wonderful humanitarian work that you are doing and tell us where we can find or contact you and your charity on social media and on the internet.
Sure. So this year, for the last few years, I've run a charity. It's called Chiraj. My mother's name is Chitra. My dad's name is Raj. So we called it Chiraj. It's essentially, it's a charity located all over the world, which empowers women in different circumstances. So in Brazil, we work with Zikavirus mothers and babies. Unfortunately, in countries like Brazil, it's a very macho guys over there. So as soon as these mothers have babies with Zika virus, they abandon their wife, they beat them up, and the government hasn't supported them as well. So it's been a journey for me growing up with these babies and mothers and seeing, we support them in every way we can. I pay rent and food and just for a group gathering. So these mothers get together, they're able to hang out. We sponsor something for World Women's Day, just manicures, pedicures. It's very small things, very simple things, but people are so grateful over there. We do that. Then in India, there's a couple of villages that I work with where young girls don't go to school a lot because of their menstrual hygiene. There's a lack of menstrual hygiene products over there. So little girls, they can't be competitive in school because they're forced to miss 5 days in a month because of their menstrual cycle. They use everything like towels, jeans, pillowcases, anything to stem the flow of blood. So what we've done over there is I bought a couple of machines where we make menstrual hygiene products. We hired the local women in the villages to encourage them to also be a part of the program. And yeah, I'm so happy. The girls are staying in school and they're getting higher grades. And I grew up with two very powerful sisters. Actually, my younger sister is my inspiration. So it's so important to keep these girls in school. And the last thing is in New York, in Long Island, women particularly, I feel are vulnerable to heroin addiction. And my goodness, when I interview a lot of these people, they come in and they are so desperate for heroin. They can't even count the number of men they've slept with to get that, to get the heroin. So what we do is we support these women in what's called sober houses. When they get discharged, you go to the sober house, and that's it. You make a decision and say, hey, am I going to get back to the streets, or am I going to make something out of myself by going to a sober house? And what our charity does is we encourage these women to say, hey, you're going for an interview, you need a suit, I got it, I'll pay for your suit. Go out there, get there. You need a laptop. I may not be able to buy you a new one, but let me get you something used. But let's encourage these women. We got to get them out there, So that's that. And the last thing what we've done this year is we created a project called Mask Up Earth. I realized when authorities were saying, wear a mask, wear a mask, wear a mask. And I realized that what about people who can't get one? Like maybe they can't get one, they can't afford one. So Mask Up Earth is a project that we've distributed about 28,000 masks all over the world to 23 countries. I love designing clothes, so I designed them. It's here, but I will show you the next time.
I told you he was a badass.
I'm sorry?
I was saying, I told you, I told
I'm
you
a badass, but I'm a sensitive badass. That's
For
what
sure.
people don't get. Like, I'm a very sensitive. I always like to portray the rap star image outside, but I'm a very sensitive guy, and I'm so appreciative of all that I've received. And I have a place to sleep, and I'm so appreciative of that. People don't have that around the world, so I'm very, very proud, and I just want to give back to humanity. I have everything I need. I don't need anything else. So my heart is with the world and mankind, and I just want to do the best I can.
It takes a strong person to so passionately and selflessly support world health. Women's health is world health. So I personally appreciate your passion, your dedication and devotion to supporting women and girls in this country and seeing that they have what they need to succeed. And addiction medicine as well, which is an underrepresented, underfunded specialty within medicine. And we do not have nearly enough resources for the number of people who suffer with the disease of addiction. We don't even have a universal understanding that addiction is a disease in this country. And so I so appreciate you lending your time, your resources, your empathy to those causes in particular, as well as being a resource for us to obtain and access reliable information about this infectious disease. I want you to tell me your website so that our friends can support your charity. And so we can look for you in future media outlets.
I forgot to tell you, everything is for free. I don't collect it. The charity is self-funded. So I don't accept donations, and I do a lot of overtime to support the charity, but absolutely no donations. But I will send you a couple of t-shirts that I designed, and it's to actually where my charity is making a stand against the current thing is racism against Asian American people. And I've just designed a couple of t-shirts which we're going into production, and we're going to distribute for free all over the country to support our Asian American people. And yeah, I have no interest in making money. They're all going to be distributed across the country. I'm more than happy to share these images for you. And if any of your viewers want them, I'm happy to send them to you.
Please tell us your website where people can find out more about you, your charity, your generous humanitarian work and philanthropy.
Yeah, sure. It's Chiraj, like I said, my mom and dad's name. So it's Chitra and Raj. So it's CHIRAJ.com.
You are a badass in medicine, in life. I am so happy and appreciative for you being here. I'm so glad to know you. And if I can help you promote or achieve your goals in this fight, please let me know. Our audience is so grateful to have you here. I wish you the best. Stay safe. And thank you so much for being who you are.
You're way too generous with your words, Alexis. Thank you. And I'm always happy to drop by the show for any sort of updates or any other updates I can do for your audience. Thanks again. And
thanks, Rajeev.
Have
Peace and love.
Evening. Peace and love. You know it.
Bye.
Later.
For more information from Dr. Fernando, you can check him out online at www.chiraj.com or www.maskupearth.com. You can also always find more information on my website, drlexlifestylemedicine.com. And as always, if you love the music like I do, you can find more at therealmichaelvm.com/music. Thank you so much for watching the show. We will see you next time.